M1033 OASIS risk for hospitalization. See, M1033 OASIS M atom is very important because it directly affect on the agency's star rating. Let's understand. When we document this correctly, CMS understand that the patient is high risk. Then CMS performs something called risk adjustment. That means if your patient is very sick and the expected hospitalization rate is adjusted higher. Now, if the patient get hospitalized, your agency is completely protected. But if you underdocument this M1033, the patient look low risk, and if the patient get hospitalized, it look like poor care, and your star rating can drop. So remember, accurate M1033 documentation protect your agency's star rating. In that, various responses we need to check the documentation to mark. That first one is a history of fall. Two or more falls or any fall with an injury in the past 12 months means any fall or history of fall documented in past 12 months. At that time we need to mark response 1. If fall with injury means patient had a fall with the fracture, at that time we need to mark uh, response 1. Second response, unintentional weight loss of total 10 pounds or more in the past 12 months. Uh, Unintentional weight loss, not a dietary weight loss. In that, if certain illnesses like malnutrition, cancer, in that patient, unintentional weight loss can occur. We need to check that. If unintentional weight loss, uh, 10 pounds or more in 12 months, at that time we need to mark this response. Response 3, multiple hospitalization 2 or more in the past 6 months. Means multiple hospitalization. Suppose patient hospitalized in March and in June. At that time also we need to select this. Multiple emergency department visit in the past 6 months. If the patient uh, had a multiple emergency department visit, at that time we need to mark this. Response 5 means decline in mental, emotional or behavioral status in past 3 months. If the patient has anxiety, depression, dementia, and OASIS M1700 series, if 1700 1, 2, 3 marked, at that time also we need to select this 5 response. Response 6. A reported or observed history of difficulty complying with any medication instruction. For example, medication, diet, exercise in past 3 months. Suppose the patient is not non-compliance with the medication, is not taking medication properly, not taking dose on timely, means it's non-compliance to medication. Also not following diet and exercise. At that time, we need to select this 6 response. Currently taking 5 or more medication means if suppose patient is in a medication list, patients taking 5 or more medication, at that time we need to mark this 7 response. Currently report exhaustion means patient is really tired or patient has a weakness, at that time we need to mark this 8 response. Response 9 is other risk not listed in 1 to 9, at that time we need to mark 10 and 9, and in the 10 none of the above.